Okay, today I'm having my drain taken out, and I'm going to weigh myself. There you have it. Not bad. Actually, that's kind of bad. I probably need to gain about 5 pounds. Hello. Today is my pre-op appointment, my post-op appointment to take my drains out. I'm looking hella crazy because I have not even done my makeup or hair or anything. I just trying to see what I can wear, and I'm gonna try to see if I can drive. I'm gonna do a test drive. I haven't been on narcotics this is day 3, so I'm hoping I will be okay driving myself. I don't have people that I can count on, so I just threw on this little, it's actually it's 90s, but I threw it on. I think it hides everything quite nicely, but underneath is the horror. So, have the binder on, and I'm going to do a test drive right now. All right, here we go. I'm walking. I'm just using my arm to hold the phone. This is not my thing. Walking down the steps. Looking a hot mess. I could have did something to myself. I didn't even brush my teeth yet. Trying to see if I can drive because I do have someone who said they would leave work and take me. I just don't like inconveniencing people. Or I could Uber. But I mean, if I can drive. I woke up this morning at 7 in pain, so I had to take 2 Tylenol. I took Tylenol like at 1 a.m. Went to bed. And then I took it again at 7. So, and then I took it again at like 10:30 just because I want to make sure I numb myself up pretty good. I don't feel like it's really kicked in yet. Here I go. There's my vehicle. Can she do it? It's like an old lady. My son called me yesterday. He says, "Mom, I'm just calling to make sure you're not stuck on the stairway somewhere." I was like, "Don't make me laugh." Oh, thinking of that making me laugh. And you're not supposed to laugh because it hurts. And then he says, "I wish I was there so I could see you walking like an old lady because I would be laughing." That made me laugh too. Oh, shoot. The trash goes out today. My trash ain't going out today. Wait, does it go out today? What's today? Yep. Oh well. I forgot something very important. See that? Yeah. Walked right out the house. Didn't put any shoes on. That's better. I'm in a little more pain than I'm expect to be right now, but I just took the Tylenol. Honestly, when I took it at 7 a.m., I was half asleep. I grabbed 2 of them. I can only take 1 pill at a time. Put 1 in my mouth, took it with some water, and then put the other one in my mouth, took it, but I felt like it didn't Like there was nothing there. I felt like maybe I dropped it. Because when I swallowed, I didn't feel the pill going down my throat. But I was like, maybe I checked around me to see if I dropped it. So I'm thinking maybe I only took one pill. That would explain why I'm in a little more pain than I would expect. Okay, I'm going to go for a drive. I feel fine. It was just the getting in that was challenging. But here we go. Wish me luck. This is so ghetto. I don't have fancy equipment. Just propped my phone, cocked it to the side. Anyway, you gotta work with what you got. Just in case I pass out, y'all can call 911. But I'm not on any narcotics. They should be out of my system by now. Today is Tuesday, and I haven't had any narcotics since Sunday. Yeah, everybody has their trash can out. Except me, but I've been laid up. I haven't really created much trash. Got on the scale this morning, and I weighed 110. Right before surgery, I was like 112. So I feel like I lost a little weight just because I hadn't been really eating first couple of days. My first real meal was yesterday. So, I do feel like I need to gain a little weight, but since I had this tummy tuck, I'm hoping I gain it more in my nether regions. So far so good. I think I'll be great driving to my surgery. All right, bye. Okay, I'm back. Drove around the block, came back. The only issue is that I feel a little lightheaded just from getting in and out. So I'll just make sure I eat before I go. Make sure I have something in my stomach. Yeah, just feel a little lightheaded, but feel okay. I'm still in the car. I don't think I can do it because I think it's the sudden burst of activity that's making me lightheaded. I don't think it has anything to do with the medicine, since I'm not taking the narcotics. And I have to, it's a long walk. It would be the longest I've ever walked going from the parking lot to the clinic. Versus if somebody takes me, they can just drop me off at the door. I think that's going to be my biggest concern, walking all the way, if I get lightheaded during the walk. I'm disappointed. I really wanted to drive myself. I don't think it's so much the driving as the activity of getting in and out, and then the walking. That may cause some lightheadedness, but I'm gonna try to eat something and see if that helps. But I'm kind of doubtful. So I'm on my way to my appointment. And I did a little bit of makeup. Did something to my hair. Well, did the best I could. I'm not gonna drive. I'm taking the Uber because I don't think I can walk from the car to the building. So this is how I'm looking. Going to my appointment to have this drain taken out and hoping I feel much better coming back. Hello. So today, day 5 post-op. It is 8:50 p.m. Today was the sweet spot. I'm starting to feel like myself again. This morning was a little rough. I don't know, the mornings are always rough. I guess overnight you're not taking the medicine, so yeah, 7 o'clock this morning I was in pain. Took Tylenol, it was fine, and I took a few doses of Tylenol throughout the day. But strangely, as the day went on, I started feeling a little better. And it's 8:50. Yeah, I feel my abs are tired, but I cleaned. I cleaned today. I can't believe I cleaned. My house was starting to look. Woo! I cleaned the kitchen. I cleaned my bedroom. My little hospital spot I had in my bedroom. I cleaned that up so it doesn't look like there was ever a disabled person in that spot. Yeah, I cleaned today. And today, day 5 post-op, I had my first post-op appointment to take the drain out. And I guess having that drain out, I feel like a normal person. And they also removed the tape covering the stitches, the incision area. I took an Uber to the doctor's appointment. I wanted to drive, but I felt very lightheaded when I drove a test drive. I don't know if it was because it was too early, I hadn't eaten, but I don't know, I just felt weak. The beginning of the day was harder for me. But as the day wore on, especially after my appointment, things got easier. I don't know if it's because I got up more Tylenol in my body, because I took several doses of Tylenol today. I took early dose before my appointment because I didn't want to be in pain. Yeah, it's amazing that the Tylenol is working. I stopped taking the Percocet on day 3 because I didn't want to be drugged up. I don't like feeling drugged up. And when I researched Percocet, I think it's oxycodone with Tylenol. So part of it is Tylenol. So take the narcotic part out of it and just take the Tylenol. It worked for me. So took an Uber to my doctor's appointment, and they had me take off all my clothes. They showed me some before pictures. Wow. And the doctor says, you don't look like you have an alien in your belly anymore. Because here I am, the skinny 110-pound girl with this protruding belly. It was amazing when I saw the picture. I try to insert a picture around in here. If I can figure out how to do that. I'm trying to get into some editing skills. But yeah, it looked like I had an alien in my belly. And he took the bandages off and everything. And first thing he said was, wow, this part is very flat. Because up here, I had a little bit of protruding belly too. And that part is very, very flat. Because he stitched my muscles all the way up. Thank you, Jesus. The bottom part is better. He said he commented that he could see my abs coming through. My sides are slimmed out. The bottom part is more swollen, and I don't know if that's because of where the incision is, but he said that will get better as well. He was very happy with how things were looking. I asked about incision wound care, and he said that we will start doing that at around 2 weeks. And I have my next appointment is next Monday. Today is Tuesday, so I have another appointment on Monday. And he wants me to continue to wear the binder until then. So I'm gonna show, I have not taken it off since my appointment. Because I'm a little scared because I have no more tape over the wound. I'm scared to look at it. Let me wash my hands because I ain't trying to get no infection. So maybe just wash my hands. Okay. I always do these videos in my bathroom because it's the best lit place. I wonder if I can get a little bit more light since it's, that probably made no difference at all since it's evening. Alright, so make sure I don't have a wedgie. Okay. I'm scared to look at it. I'm really scared. He told me I could take a shower 24 hours after the drain was taken out. Like, I feel like I'm getting some strength. Like, I can bend down and go up. So I guess I can do some squats. And I can bend down like this to pick up something. If you had asked me to do that the first 2 days, first 3 days, first 4 days, hell no. But I'm getting some strength. I do feel some soreness still. Yeah, I'll mention about the pain block that he gave me. He asked me about that, how it worked. I'll talk about that afterwards. But yes. This thing actually does feel better when it's on. I see a lot of women say that they feel better with the, what do you call this? Whatever. Compression. Ooh. I guess because your muscles feel so sore, they kind of hug your muscles. Like if you have pain or something and you kind of hold it, it makes it feel better. I'm so scared. That's where the most pain is. Actually, I don't know where the most pain is. I haven't seen it. We're going to see it together for the first time. So, sit off. This is going, I know that looks like a six pack. That's just the indentation from the compression garment. But all that's going to be smooth. That's just marks from the compression garment. So I'm getting some curvature there. This is swelling. And this is after me eating. So normally after I eat, I look pregnant. And you can see right here, I'm very flat. You can actually see, you can see the abs. The abs are going to be there. I have the abs. The problem is my belly just protruded. Let me get closer up here. I feel so weak without that. So all that is just marks from, no, it's not abs. But I'm gonna have abs. Marks from the compression. I'm gonna have to be careful how I put that on. I don't want any permanent marks. I guess I don't need to be showing my bra and everything. Have a little bit of modesty. That, I hope, is just a pocket of swelling that goes down. I did have a small love handle there, and I hope he lipoed it out. It's actually sore there. So I'm going to guess that that's where he lipo, and that will hopefully go flat. I could probably massage it. He didn't recommend, I didn't ask about massaging. He didn't recommend any, so I didn't ask. I did not have extensive lipo, so I don't feel that I need massages. I saw that some doctors don't really believe in massaging after lipo. Okay, this is where the drain was. I ain't taking that off. No can do, I'm not taking that off. So, I'm scared. Just look at the scar. I'm so scared. I'm so scared. Because when they took off the tape, I saw the skin was peeling up in the middle. But it looks very, very low. I'm so scared. Here we go. It's sticking a little bit. I don't know if I can take it off because the skin was peeling. Okay. Shut up. Okay. There's the scar. And I'm hoping that is just swelling. He said that it was. Everything is so nice and flat. I do have a little bulge right there. I'm hoping that's just so. Notice that I'm pretty much standing straight up. There's the scar. I'm hoping all this swelling goes down. Well, it should. Swelling. I've seen worse swelling than this. All right. All right. So we got it. We showed everything. My stomach feels very numb. It's very numb. I can barely feel that. Like when you go to the dentist and they numb you up and then you try to touch it afterwards, that's how it feels. Doesn't feel like it's real. Okay. So, I don't know, maybe I'll make another video about some other things like the pain block they gave me. I think I will eventually just make a video of tips because there's some things that I learned that I didn't see anybody talking about. And those are things I would want to talk about. Not necessarily things that most people talk about. So, there you have it. My incision and my day 5 post-op was a good thing. All right, I'm signing off. Bye.